Hello everyone, Happy New Year to everyone. So beginning of New Year, and we are discussing about what is something which is making a big kind of a note everywhere. The new virus for this new year, is it so? No. We are talking about HMPV, which is human metapneumovirus, which was first isolated in 2001 in Netherlands, and it is like any other virus. Primarily affects predominantly upper respiratory tract, but it can also cause pneumonia, hence going to lower respiratory tract. The symptoms are like any other virus, like respiratory syncytial virus or a common flu, what we call it as influenza B. People can have cold, cough, runny nose, headache, body pain, fever. These are the milder symptoms. It can give rise to tiredness, fatigability, and in serious condition, you can have pneumonia, wherein people produce a lot of expectoration. Is there anything to worry about? I don't think we should really need to get panic, but we should be aware about what is something going on, so that we take good care of ourselves, and in turn we take good care of our family members and the society. What we are supposed to do? We are supposed to understand and identify the symptoms. If we develop such symptoms, immediately meet your doctor. Now this is after you get the symptoms, but to avoid getting these symptoms, what we are supposed to do? So we've discussed this during COVID times also, or for any other virus this holds true. What is important, the most important is hand hygiene and respiratory hygiene. What is hand hygiene? Frequent washing of your hand with soap, usage of a hand sanitizer, alcohol based sanitizer. And respiratory hygiene is do not cough openly, use a tissue paper or a handkerchief. Do not use the same tissue paper or handkerchief again, and basically avoid going into crowded places. If you have symptoms, better to isolate yourself, take a lot of rest, have lots of liquids, take multivitamin, eat well, and the most important thing, there is no role of antibiotics in any viral infection. So antiviral is recommended for certain viruses, but for HMPV you don't have any specific treatment. As far as test is concerned, if you have symptoms similar to this, you can have something called as BioFire test, which is available right now. If you need separate isolation, the specific isolation of PCR method for HMPV is not readily available. But we don't really have to worry about. Be aware about the symptoms and the care which we just mentioned. Thank you. Have a wonderful day.